An umbilical hernia is a condition where a portion of the intestine or fatty tissue protrudes through a weak spot in the abdominal wall near the belly button. This creates a noticeable bulge beneath the skin. Umbilical hernias are common in infants. They often resolve on their own as the abdominal muscles strengthen during the first year of life. In adults, however, umbilical hernias typically require surgical repair to prevent complications. Umbilical hernias in adults can vary in size. They may be small and asymptomatic, causing minimal discomfort. Larger hernias can lead to pain, discomfort, and potential complications like incarceration or strangulation. Incarceration occurs when the protruding tissue becomes trapped and cannot be easily pushed back into the abdomen. Strangulation is a more serious complication where the trapped tissue loses its blood supply, requiring immediate medical attention. The good news is that umbilical hernias are treatable. With proper diagnosis, surgical intervention, and post-operative care, individuals can experience full recovery and improved quality of life. This case study will delve into the case of John Doe, a 45-year-old male diagnosed with an umbilical hernia. We will explore his journey from diagnosis to recovery, highlighting the importance of early detection, appropriate medical management, and patient education in achieving optimal outcomes. This case study aims to provide a comprehensive overview of umbilical hernias in adults, focusing on their causes, symptoms, diagnosis, treatment, and prevention strategies. By understanding this condition, individuals can make informed decisions about their health and seek timely medical attention when necessary. Umbilical hernias occur due to a weakness or defect in the abdominal wall at the site of the belly button or umbilicus. This weakness allows a portion of the intestine or fatty tissue to protrude, creating the characteristic bulge. In infants, umbilical hernias are often present at birth. They are thought to be caused by the incomplete closure of the umbilical opening after the umbilical cord is cut. In adults, umbilical hernias typically develop over time due to increased pressure on the abdominal wall. Several factors can contribute to this increased pressure, including obesity, pregnancy, and chronic cough. Excess weight puts a strain on the abdominal muscles, weakening the area around the belly button. The expanding uterus during pregnancy stretches the abdominal muscles, making them more prone to hernias. Persistent coughing puts repeated pressure on the abdominal wall, increasing the risk of hernia development. Other factors that can contribute to the development of umbilical hernias include straining during bowel movements or urination, heavy lifting, and ascites, which is fluid accumulation in the abdomen. Understanding the causes of umbilical hernias is crucial for both prevention and treatment. By addressing modifiable risk factors, such as obesity and chronic cough, individuals can reduce their chances of developing this condition. The pathophysiology of umbilical hernias involves a complex interplay of factors that weaken the abdominal wall at the site of the umbilicus or belly button. This weakness allows for the protrusion of abdominal contents, such as the intestines or fatty tissue, creating the characteristic bulge. The umbilicus is a natural weak point in the abdominal wall. It is the site where the umbilical cord connected the fetus to the placenta during pregnancy. After birth, the umbilical cord is cut and the opening in the abdominal wall typically closes as the muscles develop. However, in some cases, this closure is incomplete or weakened, leaving the area vulnerable to hernia formation. In adults, the most common underlying factor contributing to umbilical hernia development is increased intra-abdominal pressure. This pressure can be caused by various factors, including obesity, pregnancy, chronic cough, and straining. Excess weight, particularly abdominal obesity, places significant strain on the abdominal wall. The expanding uterus during pregnancy stretches the abdominal muscles, making them thinner and weaker. Persistent coughing, often seen in conditions like chronic obstructive pulmonary disease or COPD, exerts repeated pressure on the abdominal wall. Activities that involve straining, such as heavy lifting, constipation, or even chronic sneezing, can increase intra-abdominal pressure. Over time, this persistent or repetitive increase in pressure can gradually weaken the connective tissue and muscles surrounding the umbilicus. As the tissue weakens, a gap or defect can form, allowing for the protrusion of abdominal contents. The size of the hernia defect can vary greatly, from a few millimeters to several centimeters in diameter. Smaller defects may only allow for the protrusion of a small amount of fat, while larger defects can accommodate portions of the intestines or other abdominal organs. Section 4. Risk factors. Who is more susceptible? Certain individuals are more susceptible to developing umbilical hernias due to genetic predisposition and lifestyle factors. Non-modifiable risk factors include premature birth, family history, and African American descent. Modifiable risk factors include obesity, pregnancy, chronic cough, heavy lifting, and smoking. Understanding these factors helps in prevention and timely intervention. Maintaining a healthy weight, avoiding smoking, and practicing proper lifting techniques can reduce the risk. Section 5. John Doe, a case study of umbilical hernia. John Doe is a 45-year-old male residing in Kigali, Rwanda. He works as a construction worker, a physically demanding job that requires heavy lifting and strenuous activity. John is overweight and has a body mass index, or BMI, of 32, classifying him as obese. He has a history of smoking a pack of cigarettes a day for the past 20 years. John presented to his primary care physician with a noticeable bulge near his belly button. He had noticed the bulge for several months, but initially ignored it as it was painless. However, the bulge had gradually increased in size and had started to cause him mild discomfort, especially after a long day at work. John also complained of occasional heartburn and a feeling of fullness after meals. Upon further questioning, John revealed that his father had undergone surgery for an umbilical hernia several years ago. This family history, combined with John's age, profession, and lifestyle factors, raised concerns about a potential umbilical hernia.